Welcome to Health Steps 24/7. I'm Chris, your social media pharmacist. In this video, I will be talking on sexual health. I will provide answers to important questions on sex. This video is part 4 in a series of videos focusing on sex and sexual health. Become a health stepper. Walk more. Enjoy your walk. Subscribe to Health Steps 24/7. Like, comment, and share this video. Questions that will be answered during my sexual health talk are: can masturbation be too much? Can some exercises result in better sex? Can you get your partner pregnant from pre-cum? Should you use protection when having oral sex? What can a person do if they smell down there? What do you do if your condom breaks while having sex? Let's start with the first question. Can masturbation be too much? Masturbation, the art of do-it-yourself pleasuring, is no longer considered taboo. If you frequently get very busy self-exercising your genitals or private parts, you may feel that painful wrist and think, am I masturbating too much? Yes, it is possible to hurt your wrist while getting busy down there, do-it-yourself style. Just like any other intense motion of any body part, there is a risk of hurting your wrist or even spraining your wrist from masturbation. One potential outcome is carpal tunnel syndrome. If you masturbate frequently over a very short period of time, you can experience soreness in the genitals or genital area. Heavy or rough masturbation can also cause bruises or cuts. So yes, you can masturbate too much. However, the good news is that for masturbation to be considered as too much, you would need to be self-exercising or masturbating your genitals or genital area very often, approximately 4 to 5 hours daily. Some factors that could be considered as signs that you may be masturbating too much include: you spend more money than you budget for on sex toys. You feel guilty or ashamed after masturbating. Your personal life is being negatively affected due to masturbation. Your relationship with your sex partner is being negatively affected due to masturbation. Your daily activities at work or home is being negatively affected. Masturbating is consuming too much of both your time and energy. If you are thinking whether masturbation, especially if it's too much, can cause ED or erectile dysfunction, the good news is that masturbation is normal and does not cause ED or erectile dysfunction or affect the quality or how often a person has erections. In fact, masturbation can help with erectile dysfunction that is caused by psychological issues, including stress and anxiety. Unless masturbation is causing you distress or affecting your daily activities negatively, it is normal or okay to indulge. Let's go to the next question. Can some exercises result in better sex? Yeah, sure. Some exercises can result in better sex. Good sex requires both energy and stamina. Therefore, engaging in exercise or workout routines that include stretches and strength training can help you build or develop your muscles and improve your flexibility, making it easier for you to get into sex positions, maintain sex positions, and get out of those sex positions. One of the best exercises for both men and women for an upgraded sex life are Kegel exercises. Kegel exercises help to strengthen the muscles of the pelvic floor, resulting in not only an improvement in sexual health, including more intense orgasms, but also provides other benefits, which includes improved urinary and bowel movement control. Let's go to the next question. Can you get your partner pregnant from pre-cum? Can a woman get pregnant from pre-cum? The answer to this question is yes. However, the risk or chances of getting your partner pregnant from pre-cum is low. Pre-cum, also called pre-ejaculate, is a small amount of fluid that comes out from a man's penis before cum or ejaculate when turned on or aroused. Pre-cum in most cases does not have sperm. However, some men can have a small amount of sperm in their pre-cum or pre-ejaculate. When sperm is present in pre-cum and this pre-cum enters a woman's vagina, there's a chance that the sperm present in the pre-cum can fertilize her egg and result in pregnancy. Let's go to the next question. Should you use protection when having oral sex? The answer to this question is yes. Like any other type of sex, including vaginal and anal sex, oral sex can also cause the spread of sexually transmitted diseases or STDs. Therefore, to protect both you and your partner, protection including the use of dental dams placed in the mouth to serve as a barrier for viruses and bacteria, and female condoms placed inside the vagina or male condoms placed on the penis should be used every time you engage in oral sex. Let's go to the next question. What can a person do if they smell down there? You just may be worrying too much about that smell down there. According to Dr. Mary Jane Minkin, Clinical Director of Obstetrics and Gynecology at Yale University School of Medicine, most of the women who come in saying, "I smell really bad," smell fine. However, it is also important to note that that smell down there can be a sign of a bacterial infection if there is a strong odor or discharge. Therefore, it is recommended that if you are experiencing this, to see your gynecologist. If you don't have an infection and you are still concerned about the smell down there, doing the following may help. Avoid the use of pungent or spicy foods. Use RepHresh Vaginal Gel. RepHresh Vaginal Gel is an odor eliminating gel that helps to rebalance and maintain a healthy pH, vaginal pH that is. When your vaginal pH is not balanced, odor-causing organisms can grow. The recommended way to use RepHresh Vaginal Gel is once every 3 days or when pH imbalance is most likely to occur, such as after douching, after your menstrual period, or before or after having sex. Both douches and vaginal sprays can cause irritation and also alter your vagina's natural flora, increasing your risk of becoming infected or even masking an existing infection. Let's go to the last question for this video. What do you do if your condom breaks while having sex? A condom breaking during sex can cause panic. In most cases, since that thin sheet of polyurethane or latex, also called a condom, is the only barrier protecting the two partners having sex from possibly getting a sexually transmitted disease or STD, or an unwanted or unplanned pregnancy. However, if the situation with a broken condom is dealt with immediately, no harm may be done. If you are having sex and your condom breaks, stop immediately and discuss with your partner what has happened. During your discussion, these 3 questions should be answered. Is your condom still on your penis, or is the condom inside the vagina or rectum? Did you just start having sex, or were you close to ejaculating? Did your condom break after coming or ejaculation? If the condom broke after ejaculation, attempt to remove as much semen from the vagina or rectum. Squatting and pushing with the vaginal muscles, similar to a bowel movement, are good ways for women to remove semen from the vagina. The genital area can then be gently washed with soap and water. If you are aware or suspect that body fluids were exchanged because of your condom breaking, get an HIV test done. Even if you both test negative, you may still be advised to start a 28 days course of antiretroviral therapy prescribed by your doctor, consisting of a combination of M3-cytobine and tenofovir, plus raltegravir or dolutegravir. This course of drugs is a post-exposure prophylaxis therapy or treatment, also called PEP or PEP. HIV post-exposure prophylaxis therapy is given in emergency situations to prevent HIV infection. It should be noted that post-exposure prophylaxis therapy must be started within 72 hours after a recent possible exposure to HIV. To avoid an unplanned or unwanted pregnancy, speak to your doctor or pharmacist as soon as possible about the use of emergency contraception. It should be noted that emergency contraception must be started within 3 days to 5 days after unprotected sex for it to be effective. The earlier emergency contraception is started, the more effective it is. Thanks for watching this video. Feel free to comment, like, share, and subscribe to this channel. Join me next time for more health videos. Bye for now.